this is Dr. Donald Pelto, and I'm excited because this Saturday there's going to be a special Changing Diabetes Day. And at this meeting I'm going to be talking about a few tips to prevent foot wounds. And just as a preview to this talk, there are going to be two talks. One's going to be happening around noon and the other one's going to be about 1 p.m. And in both of these talks I'm going to be going over 3 ways to prevent a foot wound. And in this, it's going to be a portion of this book. It's a healthcare guide to diabetes in your feet, and really going to go over a few of the tips. So let me just give you a preview of what these 3 tips are. The first tip is very, very simple. So some things are simple to do, but they're also simple not to do. So the first one is to examine your feet every day. By looking at your feet, by looking to see if there's any cuts, any scrapes, any problems, you can vastly reduce the amount of foot wounds or problems that you can have with your feet. The second thing is to wear diabetic shoes. That's another reason and another way that you can reduce diabetic foot ulcers, because diabetic shoes reduce the friction on your feet, but also in order to get diabetic shoes you need to be seen by a foot doctor. And what's evaluated is your blood flow, if you have any high pressure areas, and if you have poor feeling in your feet. These are all essential for reducing the risk of having an ulcer. And the last thing is to get professional help for your calluses. Those are the 3 topics, and I'm going to explain in depth why you should be getting professional help and not using a razor blade on your own at home to treat your calluses. So that's what we're going to be talking about. It's going to be actually happening this Saturday at the DCU Center. We'll see you there.